what would you say if that is part of the gap and really connecting the dots from the cerebral standpoint?
Yeah.
What would you advise of connecting some of those dots with nephrologists to help encourage some of that earlier adoption and obviously the intellectual aspect of what makes sense to further the initiatives within kidney care?
Oh, so how do you get them to move? Is that what you're saying?
Yes,
Like,
yes, yes,
uh,
yes. We'll
well,
simplify it. How do we get
yeah,
nephrologists to move and really be at a
uh,
faster pace relative to especially other fields that you're
other
mentioning in
fields.
healthcare?
Um, I would say like that there, I mean, one is of course the monetary models, right? Like some of these value-based care models had certain incentives built in to have certain results. Like for instance, they had a huge transplant bonus. I don't know if you heard about that, but it's $15,000 to the physician or physician practice if you got the patient transplant bonus. That kind of moves the needle. Do you see what I'm saying? And so incentive structures there as well too. Also, I mean, I think there could be a component where in fellowships you need to like I'm not saying you need to teach all of value-based care because value-based care is various things, right? There's the financial incentives and models that are there. There's the clinical pathways and like logistical support that all these doctors need. Many of these clinical pathways and clinical endpoints, they should be taught in fellowships, right?
Mhm.
Meaning you should have an optimal start on dialysis. That should be a part of your
Mhm.
training. You should encourage people to do dialysis at home. That should be in your training. You should make sure your patients are on optimal medications, ACE/ARBs, SGLT2s. That should be in your training, right? And even things like conservative care on these patients, like who needs dialysis, who doesn't. Does everybody go on dialysis? These should be taught in fellowships as well. So even though I don't think, you don't need to sit down and read executive order like I did, because I actually got
Mhm.
a chance to present on it. But
Mhm.
you do need to understand the endpoints of value-based care because they are good endpoints if we can get there.